Lawrence, News and Program Director for WHOW and WEZC. We take pride in being Clinton and Central Illinois' local radio stations each and every day, 7 days a week. What does local news mean? Here's a sample.
The current scoreboard is hanging on by a thread.
The reason that Constellation is decommissioning the siren use for nuclear emergencies is that the Nuclear Regulatory Commission is having this be put in the FEMA rep manual to satisfy a requirement that all notifications from a nuclear perspective will have to go to a digital monitoring. Sirens will no longer be an option.
Out-of-towners that come in and go door to door, on these roof claims.
You hear the local people that make the news every day, 7 days a week on the big 1520 AM, 92.3 FM, and 106.5 FM WHOW, and on your easy choice for soft hits, 95.9 FM WEZC.
Your friend in Central Illinois, WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in studio today, Sharon Mills with the DeWitt County Mental Health Board. Good morning, Sharon. How are you?
Good morning, Seth. Glad to be here.
Yeah, thanks for coming out and talking with us. Always good to have you in. And let's remind folks, I feel like I catch up with you only once or twice a year. So let's remind folks, what is the Mental Health Board in DeWitt County? What do you do? How do you operate? Let's start there today.
Well, first of all, I'd like to say happy Mental Health Awareness Month, which is May. The DeWitt County Mental Health Board was established in 1967 here in DeWitt County. Through a property tax levy, we serve residents with mental illness, substance use disorders, and/or intellectual and developmental disabilities by providing funding to organizations that provide those services.
Gotcha. What does that number change? That dollar amount year to year that comes into the mental health board, does that change on a yearly basis based on those like property values and things like that?
The amount does change, and it's typically based on a request that the Mental Health Board makes to the county board outlining the organizations and the services and programs that we'd like to fund in the upcoming fiscal year. Gotcha.
What is that number typically for the mental health board?
Well, last year it was around $640,000.
Oh, wow. So a significant chunk of change.
Yes.
Got it.
We funded we're funding 8 organizations now for fiscal year 25, which ends at the end of November.
Like who? Do you mind highlighting some of those for us?
Sure. Heritage Behavioral Health Center is our primary mental health agency serving DeWitt County, with the satellite location here in DeWitt County in the old Richland building. The Clinton Community YMCA utilizes some funding in conjunction with Heritage to provide some free memberships to individuals and their families who are receiving Heritage services.
Okay.
The Children's Advocacy Center works to investigate cases where children are alleged to have been severely physically or sexually assaulted. So we help fund that agency, which has a presence here in Clinton. Encore Developmental Services has employment service program for people with intellectual and developmental disabilities. So we help that program. Growing Strong Sexual Assault Center. Heritage, I mentioned them. Piatt County Mental Health Center provides prevention education in DeWitt County schools, both Blue Ridge and Clinton Community Unit School District. And Piatt Prairie Land Service Coordination also works to coordinate services for individuals with disabilities who are residents here in DeWitt County, as well as in other counties that they serve. Gotcha.
Now, you were telling me that I guess I should ask this first before we kind of go into that grant or the new request for funding cycle are those the only efforts that the Mental Health Board supports? What other ways are you supporting the community?
Well, I should specifically mention the ROSC, the Recovery-Oriented System of Care. We're both serving as a coalition member on the ROSC, as well as helping to provide some funding for the coordinators' benefits and then other activities that the ROSC might be having.
Gotcha. When it comes to the money pouring into the community from the mental health board, is there is part of we were talking about the 708 statute that was passed back in many years ago now.
1965.
Yeah,
the
many years
Community
ago
Mental
now.
Health Act.
Yeah. Is there part of that statute that says you have to pour a certain amount of the levy that you receive into the community on a yearly basis? Like, are you able to build up reserves for special requests we'll talk about here in a bit? How does some of that work?
Well, there are a number of ways that the board can provide its funding. We typically have an annual funding process whereby nonprofit and governmental organizations who serve DeWitt County residents can apply for funding for mental health related needs.
Okay. Well, let's dive into, Sharon, that latest request for funding cycle that is on its way. I believe you mentioned June 1st is when that gets started. Is that right?
We have an online application process. It starts on June 1st. It'll go through July 2nd. We also will have a couple of technical assistance sessions for people who maybe applied before, but it's been a year. So getting into that system, they may need a little bit of a refresher. As well as for new applicants. And those technical assistance sessions will be on June 10th and June 18th.
Okay.
Anybody who's interested in applying for funds or just learning more about the Mental Health Board and what they do can reach out to me. I'm at mills@dewittcountymhb.com. And of course, we've got a website, dewittcountymhb.com.
Okay. Yeah, you mentioned those technical sessions. Will that be an in-person thing? Will it be a Zoom? Will
They'll
it be both?
Over Zoom.
Okay. Yeah.
And of course, if somebody had a need to meet outside of those particular sessions, we can arrange that too.
Okay. So what will this look like? Kind of give us the time, what things you'll be going through. What are those going to look like?
The application itself will ask about the programs that organizations want to fund, what the goals and outcomes are for those programs, who they intend to serve, what services will be provided, and then a couple of questions, just about things that perhaps the Mental Health Board should be funding outside of their particular requests, so that we're getting feedback about things that organizations are seeing in the community as well.
Yeah, I'm sure. I venture a guess you're pretty well connected in the community, being around as long as you have, and probably your board is well connected, things like that.
Yeah. We've got a volunteer 7-member board. Representing the schools, representing the health department. We have a new board member coming on from the hospital.
Okay.
So I'm glad that you brought that up, though. We do have a vacancy on our board. So if someone's interested in learning what that might be about, and wanting to serve as an advocate for DeWitt County residents, especially related to mental health, substance use, and developmental disabilities, I would love to talk to that person.
Well, let's dive into the board a little bit. You mentioned 7-member board. What's their role? How do they play into the operation? I don't want to say operations, how the mental health board, distributes funding and things like that. Let's highlight the board a little bit. What's their role?
Okay. Well, certainly with our funding process, they review and discuss all of the applications. After we've had an initial meeting to review those applications as a board, we also hold about a 20-minute meeting in July or August with each applicant agency to ask questions about their proposals. The board members participate in those meetings, and then we make a decision about a budget that we want to present to the county board.
When it comes to the time commitment to be on the board, I guess, one, who are you looking for? Do they have to have a background in whether mental health, physical health, whatever the case may be? Do they have to have a background there? And what's the time commitment for that person?
Well, we do meet monthly on the third Tuesday of each month at 5 p.m. at the library in the activity room. So those meetings typically last an hour and a half. Depending on how the board member wants to get involved, there may be additional events they can support, like a training or a speaker that we're bringing in. So it could be few additional hours a month. Certainly in July and August, when we're reviewing applications and then making budget decisions, the meetings can last a little bit longer, and there may be, subject to board members' availability, participation in some of those meetings with agencies.
Excuse me. So tell me a little bit about that application for the grant cycle that's come, or the funding cycle that's coming up, Sharon. What's in it? What do you need to know from from those that are applying, whether it's a group, whether it's a business, whatever the case may be? What do they need to have ready in that application?
Well, knowledge of what it is they're requesting funds for, the amount of the requests they're making. They need to provide for us list of expenses as well as revenues for the particular program or service they're seeking funding for, goals, objectives, their plans to evaluate that program, so that we have a sense of how our funds are doing and who it is that they're serving.
So once that process is over, the grant funding or the funding has been distributed and those sorts of things, do you ask for reports back to say, hey, tell us how you're doing with this money that we've given you? Do you ask for those types of things?
Yes, we do ask for quarterly reports from each of the agencies, and certainly in preparation for our annual report, we ask for summary reports of how funding has been spent, impacts that any of the agencies are seeing. And then we use that information also as we're making decisions for the following year.
Sure. Gotcha.
Especially if it's a provider that has been funded in the past, but we're not limited to the organizations that we fund. Except for being nonprofit or a governmental organization, and then serving in one of those three areas related to mental health, substance use, and or intellectual and developmental disabilities.
Now, if a group, organization, whatever the case may be, comes to you and they say we could use, $7,500 for a new program we're rolling out, are they guaranteed to get that $7,500, or how does that determination get made by the mental health board?
Well, none of the organizations that apply are guaranteed. Certainly, we'd like to fund every organization at the amount that they request, but that isn't always possible. So sometimes our questions with the groups that we meet with are, what would this program or service look like if we weren't able to fund you in the amount that you've requested, because we've only got so much money to distribute.
Makes sense.
And you'd asked about levy from the Community Mental Health Act. Boards can levy up to 15 cents per 100 equal assessed value on the property taxes.
And what is the rate for DeWitt County at this point?
We can levy up to 15 cents.
Is that what they levy then?
No, I think we're around the 10-cent mark, almost at the 10-cent mark.
Got it. Very good. Well, Sharon, where do folks learn more about the upcoming request for funding cycle? Again, remind us when that gets started, the details on that one more time for us.
Okay, it starts June 1st. It goes through July 2nd. It's online. Folks can give me a call or email at smills@dewittcountymhb.com. Or check out our website, DeWittCountyMHB.com.
Very good. That is Sharon Mills with the DeWitt County Mental Health Board in studio with us. More to come with Sharon on the morning show.
WHOW.
weeknow.com.
Let's check the markets now on the RFD Radio Network. I'm Jim Taylor. Steady trade for corn and beans at this hour. Wheat trading lower. July corn 461 up a penny and a half. September corn down 1 3/4, 436. December new crop 448 1/4 down 2 1/2. July beans 1064 up 3 3/4. August beans up 3 1/2, 1059 1/2. November new crop 1053 1/4 up 2 3/4. July wheat down 11 3/4, 530 3/4. September wheat down 11 1/2, 546 1/2. July bean meal 295.30, that's down 90 cents. July bean oil 49.77 up 42 cents. Livestock market August feeders $2.99.25 down $1.12. June live cattle down 80 cents, $2.15 even. June lean hogs 98.17 down 12 cents. Energy market July crude oil 60.91 down 62 cents. Jim Taylor on the RFD.
MR Systems Wireless is your local internet provider for Clinton and surrounding area. They have the products you want and the local service you deserve. MR Systems Wireless Internet service for home or business includes unlimited data, unlimited streaming, and unlimited calling. Plans start at just $48 a month and get a free Roku 4 lease with our media packages. Get the speed you need with MR Systems Wireless. Call them at 935-2100. That's 935-2100 for MR Systems Wireless.
If you've got allergies this season, we have relief. CEO Paul Scarin here from Warner Hospital and Health Services in Clinton. Come to our walk-in clinic inside our family medicine. No appointment, no problem. See our icon at DeWittDailyNews.com.
DeWittDailyNews.com is the area's leading local news source 24 hours a day, 7 days a week. Get the latest local news, obituaries, police blotter, weather forecast, and more with no paywall. Head to DeWittDailyNews.com to get the local information you need to know.
Your friend in Central Illinois, WHOW.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Sharon Mills with the DeWitt County Mental Health Board in studio with us for this morning. And Sharon, let's highlight, obviously May is Mental Health Awareness Month. Let's highlight something you've done with the library for this month. What's going on?
Okay, well, I think this may be, well, actually, we've done this in the past with the library, but the library worked with us to host a display for Mental Health Awareness Month, including books, as well as drawing on a Mental Health Awareness Month campaign that Mental Health America put out, which includes lots of different kinds of things, like some worksheets about setting boundaries, a grocery list for healthy eating, journal prompts to get folks to start reflecting and thinking. So a lot of different things that people can pick up while they're at the library or check out.
Very good. Very good. You mentioned you've done that in the past, so continuing that this month. And with May being Mental Health Awareness Month, was there a theme? Is there something, whether it's the library display or just mental health in general, that's really dialed in on this year?
Well, there are different organizations with different campaigns, each of them with a theme. The Mental Health America theme this year, I believe, was moving forward together. So one of the sheets they put out was about being an advocate for mental health issues. If someone has, especially if someone has that interest, but just learning about mental health as well can be useful.
Gotcha. Very good. So check that out. And Sharon, as we talk here for this morning and kind of come up on the end of our time together, let's just highlight some of the things, whether it's going on in DeWitt County, some of the services that this mental health board supports. What do you have for us this morning?
Well, I mentioned the ROSC before, and I think the ROSC has done an amazing job of building community around substance use prevention, treatment, and recovery. Something that the Mental Health Board has done with the ROSC is support their Narcan training in distribution throughout the county. One of the ways that we have done that are by purchasing 24/7 accessible weatherproof cabinets that Narcan can be housed in and then distributed at any time to someone who may need it or want it. Some of the places that are hosting those cabinets are the Clinton Library, the Farmers City Public Library, the Weldon Village Hall, and then the fire departments in Kenny, Wapella, and Waynesville.
Oh, wow. Cool. So they're all over the place then.
Yes.
Yeah,
so we've, tried to put them throughout the county. We were able to purchase 6 cabinets. And then other organizations are providing Narcan as well, like the health department or the housing authority. Residents or clients can pick up Narcan while they're in those facilities. or just stop in the health department anytime during their business hours
Yeah.
to pick that up.
Am I remembering right? Narcan has become rather affordable lately. I don't remember if there was like some sort of governmental action that made that possible. Am I remembering that right?
You may be. I
Okay.
believe pharmacists now, when opioids are prescribed by a doctor, are also suggesting Narcan as an add-on, just as a preventative in case an accident were to happen. Perhaps somebody forgets the medication that they've already taken and ends up taking too much.
Okay.
Or somebody else gets into an opioid accidentally.
Got it. Well, and it definitely has become much more accessible, that as well in
Right.
recent years.
And as far as the cost, the distribution that I'm talking about, the ROSC is doing, that's entirely free. So there is no cost for those.
Got it. Very good.
Narcan.
Very good. Anything else on ROSC we haven't put out there you wanted to touch on? I know Maggie, is it Maggie Memitz?
Yes.
She's done a great job with that
Yes,
program.
she's done an awesome job. I guess a couple of other things outside of the ROSC I'd like to
please.
say, and one of the organizations I hadn't mentioned yet is Dove Domestic Violence. The Mental Health Board helps to fund the coordinator's salary and use of the space here in Clinton for the Dove office. They are looking for a volunteer who's willing to go through the 40-hour domestic violence training so that that person can help in specific ways at Dove that are more client facing.
Okay, gotcha. So look forward to that training. Very good. Sharon, I still have a couple minutes left with you. What did I miss today that you want to put out there?
I wanted to mention that Heritage Behavioral Health Center continues to provide mental health first aid and youth mental health first aid training here in DeWitt and in Macon counties. Those trainings are free.
Okay.
And those trainings can help someone respond effectively and appropriately to someone who may be exhibiting signs that they're in crisis or struggling in some way. There is a youth mental health first aid training coming up here in DeWitt County on August 1st. It will be held at the Vault. It is a day-long class, but I can tell you from having both taken and taught the class that it's invaluable to anyone, just as a matter of how we react and respond to others, whether they may be having a crisis or not.
When is that training again, Sharon?
That is in August, and you can check out www.heritagenet.org for more information about their events.
Sounds good.
And then the last thing I wanted to mention, which I recently found out about at the health fair that the hospital put on just last week or the week before, I met a woman, Dr. Becky Largent. She's an advanced practice psychiatric nurse. She lives in Leroy, but she is serving DeWitt County residents. She's accepting new clients and serving children ages 5 and above, teens and young adults as her primary clientele. She provides psychiatric evals, diagnosis, medication management, counseling, and support for the family, treating things like anxiety, mood disorders, ADHD, behavioral issues, autism, and other disorders.
Gotcha. So that's a new resource in DeWitt County as well. Very good. Sharon, I've only got about 30 seconds, give or take. One more time, highlight the funding application process that is upcoming for the Mental Health Board. One more time on that.
Okay, it opens up June 1st online. Please get in touch with me, and I can get you started.
Very good. And the website and ways to get a hold of you, Sharon. How do folks do that?
smills@dewittcountymhb.com. Check out our website, DeWittCountyMHB.com.
That is Sharon Mills with the DeWitt County Mental Health Board, our guest in studio this morning. Again, the morning show streams to Facebook and YouTube, brought to you by Peterson Insurance.
WHOW.
The Big 1520 WHOW Clinton, 92.3 FM, W222 BG.